Hey there. If you're watching this right now, chances are you or maybe someone you really care about is navigating the incredibly heavy and honestly often overwhelming journey of trying to conceive. And I just want to start by acknowledging the anxiety, the late-night Google searches, the quiet, hidden struggles that come with infertility. It's completely valid to feel exhausted by all of it. But today, we're going to try and replace some of that fear with facts, with clarity, and most importantly, with hope.
Welcome to This Explainer. Today, we're focusing on one of the absolute leading causes of female infertility, fallopian tube blockage. Think of this as your clear, supportive patient guide. We're going to walk through this together, using medical insights directly from the specialists at ART Fertility Clinics. Our goal here is to just cut through the scary medical jargon and give you a really straightforward understanding of your body and what your options are.
Here's our roadmap for today. We're going to cover 1. What are tubal blockages? 2. Common causes. 3. Diagnosing tubal health. 4. Fertility treatment options. And finally, 5. Common questions answered. Nice and simple.
Okay, Section 1. What are tubal blockages? Let's jump right in. To really understand the problem, we first need to understand the incredible, delicate mechanics of the female anatomy.
Think of your fallopian tubes like a bridge, or a vital pipeline. They're the essential pathways that connect your ovaries straight to your uterus. When ovulation happens, an egg drops right into this tube. Meanwhile, sperm travels up through the uterus and into the tube to meet it. So this bridge is the literal, physical meeting place for conception. Without this open pathway, natural fertilization just simply can't happen.
So naturally, a blockage acts as a physical barrier on that bridge. It either prevents the sperm from ever reaching the egg in the first place, or if they do somehow manage to meet, it stops the fertilized embryo from safely making its way down into the uterus for implantation. The natural mechanics of the whole journey are entirely interrupted by this roadblock.
Moving on to Section 2, Common Causes of Blockages. A really normal question to ask right about now is, well, how does a roadblock like this even happen? Let's look at the causes, and please, keep this in mind. These are medical conditions, not personal failings.
As we go through these common culprits, I really want to emphasize that past infections or surgeries are incredibly common. Pelvic inflammatory disease, often from a past infection like chlamydia or gonorrhea, is a massive cause of inflammation and scarring. But it's not just infections. Scar tissue from past abdominal surgeries, even something as common as a C-section, can inadvertently cause damage. And then everyday reproductive disorders, like endometriosis or uterine fibroids, can also create scarring that physically pinches those delicate tubes shut.
Now, you might hear your doctor use a fairly intimidating word, hydrosalpinx. Let's completely demystify this right now. If we break it down, it just means you have an inflamed, damaged tube that's blocked near the ovary and is filled up with a clear, watery liquid. It's usually just the lingering aftermath of a prior infection. It sounds super scary, but for a fertility specialist, this is a very well-known and treatable condition.
If you're sitting there thinking, how on earth did I not know I had this? Well, the truth is, blocked fallopian tubes are almost always completely silent. The vast majority of women experience absolutely zero symptoms. No pain, no weird warnings. Literally, the very first clue is usually just the fact that they're having trouble getting pregnant. So let me offer some massive reassurance here. It is completely normal that you didn't notice anything was wrong.
Section 3. Diagnosing your tubal health. The crucial thing now is figuring out exactly what's happening inside your body. How do doctors take this from a guessing game to a concrete diagnosis?
Your doctor will follow a highly logical, step-by-step progression to check your tubal health, starting with the easiest stuff. Step 1 is just a conversation about your medical history and a standard pelvic exam. Step 2 moves into specialized imaging, like an ultrasound or an X-ray to get a better look. And if they really need to see what's happening up close and personal, Step 3 involves direct surgical visualization.
Let's talk about the most common imaging test, known as an HSG. Don't be scared off by the giant acronym. It's really just a specialized X-ray where a doctor gently introduces a safe contrast dye into your uterus. On the monitor, this dye literally lights up your reproductive pathway. If the dye flows smoothly out the ends of your tubes, great, the bridge is open. If the dye stops abruptly, the doctor knows exactly where the blockage is.
Depending on your specific situation, your doctor might choose one of these two alternative routes. A sonohistogram is a really great non-invasive option. It uses saline and a standard ultrasound to check the space inside your uterus and rule out things like that fluid-filled hydrosalpinx we talked about. But on the flip side, if your doctor needs 100% certainty, they might recommend a laparoscopy.
This is a minor surgery using a tiny camera to provide direct, unquestionable visualization of the womb and your tubes.
Section 4. Your fertility treatment options. Okay, let's pivot to the most important part of our explainer, the solutions. Because discovering a blockage absolutely isn't the end of the road, it's just a pivot point.
You essentially have two main paths forward, and I like to think of them this way. You can try to repair the bridge, or you can take a helicopter right over it. Tuboplasty is the surgical option to actually repair and reopen that damaged fallopian tube. IVF, or in vitro fertilization, well, that's the medical helicopter. It creates the embryo safely in a lab and places it directly into the uterus, completely bypassing those blocked tubes altogether.
Now, while repairing the tube sounds like the obvious fix, we have to be totally honest about the risks of surgery. Tuboplasty isn't perfect. Your body's natural healing process can actually cause new scar tissue to form, which just blocks the tube all over again. And more seriously, a repaired tube significantly increases the risk of a severe ectopic pregnancy. That's when an embryo gets stuck and starts growing dangerously inside the tube instead of the uterus.
Because of those surgical risks, I really want to share this incredibly reassuring takeaway from the specialists at ART Fertility Clinics. They note that IVF is the most effective alternative. Listen, even if your tubes are completely 100% blocked, IVF provides a highly successful detour. Your dream of carrying a child is absolutely still alive with this technology.
But there's one crucial caveat to keep in mind, specifically regarding hydrosalpinx, those fluid-filled tubes. That toxic fluid can actually leak into the uterus and lower your IVF success rates. Because of this, your doctor might actually recommend surgically removing those severely damaged tubes before you start IVF. But it's a careful balancing act, because removing a tube can sometimes slightly decrease your ovarian reserve. So your physician will carefully personalize this specific decision with you.
Finally, Section 5, Common Questions Answered. Let's tackle the top, burning questions patients usually have when they first get this diagnosis.
This is almost always the very first, most terrifying question that pops into someone's mind. Does this mean I am completely infertile? Am I never going to have a baby?
Well, the answer is this really comforting mix of reality and amazing science. The reality is, yes, natural conception is impossible if both tubes are completely blocked, just because the sperm and egg literally can't meet. But, and this is a huge but, medical interventions like IVF make pregnancy highly achievable. The door to natural conception might be closed, but the door to a healthy pregnancy is still wide open.
Another super common anxiety is wondering if you missed a warning sign. People always ask, what are the absolute first signs of a blockage?
Like we learned earlier, the most common sign is nothing at all. Silence is typical. But some women do notice persistent pelvic or abdominal pain, especially around their period. If you have unusual vaginal discharge, that can sometimes be a clue of a fluid-filled tube. And unfortunately, for some women, a dangerous ectopic pregnancy ends up being the very first clinical sign that there's a blockage. The takeaway here? If you have persistent pain, don't ignore it, go see a doctor.
We've covered a ton of ground today, from understanding the physical roadblocks to exploring the really incredible medical detours available to you. You're no longer in the dark. You know what questions to ask, and you know that a tubal blockage is not the end of your dream of starting or growing your family. Armed with this knowledge from ART Fertility Clinics, the ball is back in your court. Modern science has built the detour. So, are you ready to take the next empowering step on your journey?